Hey there and welcome. Today we're going to crack open one of the trickiest puzzles in all of neurology, how to figure out exactly where a stroke has happened inside the brainstem. To do that, we're going to decode a really elegant and incredibly useful tool known as the rule of 4.
So, think about it. How do you solve a mystery that's happening inside a space that's smaller than your thumb but is packed with the most critical wiring in your entire body? The brainstem is basically the superhighway for information between your brain and everything else. So when a lesion happens here, it can be devastating, and pinpointing the exact spot, well, that's a massive diagnostic challenge. Here's our game plan for how we're going to tackle this. First, we'll dig into the challenge itself. Then, I'll introduce you to the rule of 4. We'll break down what are called the medial M and the lateral S structures, decode the absolute key clue of cross signs, and then, at the end, we'll put it all together into a really powerful clinical approach.
All right, let's dive right in with the challenge. Why on earth is a brainstem stroke such a diagnostic puzzle to begin with?
Well, just take a look at this. The brainstem is this incredibly compact and vital stalk that connects your brain to your spinal cord. It is just jam-packed with pathways that control literally everything, from your heartbeat and breathing to your ability to move and feel. So when something goes wrong in this super dense network, the symptoms can get really complex and confusing, which is exactly why you need a systematic approach.
So, how do we cut through all that complexity? Well, that brings us to our secret weapon, the rule of 4.
At its heart, the rule of 4 is a simple, but honestly, a brilliant mnemonic. It organizes the brainstem's anatomy by identifying 4 crucial structures that run down the middle or medially, and 4 structures that run along the sides or laterally. This whole framework is what lets a doctor use a patient's symptoms to literally map the location of the lesion.
And the best part? The mnemonic is wonderfully easy to remember. The 4 medial structures all just so happen to start with the letter M. And the 4 lateral structures, they all start with S. Just think S for side. This simple medial versus lateral split is the absolute foundation of the entire rule.
So let's start building this out, beginning with those 4 medial M structures. These are the pathways running right down the midline of the brainstem. Okay, so our 4 M's are the motor tract, the medial lemniscus, the medial longitudinal fasciculus, and the motor nuclei of certain cranial nerves. Let's kick things off with the big one for movement.
The very first M is the motor tract, which you might also know as the corticospinal tract. You can think of this as the main highway for all of your voluntary movements.
Now, here's the really crucial part. It controls the opposite side of the body. And why is that? Well, it's because these nerve fibers physically cross over from one side to the other deep inside the brainstem. It's a process called decussation. And remembering this crossover is absolutely essential to understanding the signs of a brainstem stroke.
All right, next up in our medial group are 2 more critical pathways, the medial lemniscus, which handles sensation, and the medial longitudinal fasciculus for eye movements.
The medial lemniscus carries the signals for things like vibration and proprioception. That's your sense of where your arms and legs are in space. And, just like the motor tract, it serves the opposite side of the body. Then you've got the medial longitudinal fasciculus, or the MLF. Think of this as the delicate wiring that makes sure both of your eyes move together, perfectly in sync. So now that we've got the medial structures down, let's shift our focus to their lateral counterparts, the 4 S structures, for those pathways running down the side.
Our 4 S's are the spinothalamic tract, the spinothalamic tract, the sympathetic pathway, and the sensory nucleus of the 5th cranial nerve.
Let's start with the 2 spinotracts. These guys are responsible for coordination and a different kind of sensation than what we saw on the medial side. So the spinocerebellar tract connects to the cerebellum, which is kind of the brain's coordination center. If this gets damaged, it causes something called ataxia, that classic sign of clumsy, uncoordinated movements. The spinothalamic tract, on the other hand, is the specific pathway for sensing pain and temperature. Next up is the sympathetic pathway. This isn't just one tract, but it's the entire system responsible for our fight-or-flight response, and its control signals run right down the lateral side of the brainstem. Now, if this pathway gets damaged, you get a very specific cluster of signs known as Horner syndrome. It's a classic triad of symptoms: a drooping eyelid, which is called ptosis, a constricted pupil, or miosis, and a lack of sweating on one side of the face, called anhidrosis. Seeing these 3 things together is a huge clue that points directly to a lesion in the lateral brainstem. Okay, so we've defined the medial and the lateral pathways. Now it's time for the big aha moment. The single biggest clue that tells you a stroke is in the brainstem and not somewhere else. It's time to decode crossed signs.
This right here is the absolute key. In a typical stroke that happens higher up in the brain's cortex, any weakness in the face and body will be on the same side, both opposite to the lesion. But with a brainstem stroke, the signs are often crossed. You might see facial weakness on the left, but body weakness on the right. This unique pattern happens because the cranial nerves that control the face exit right at the brainstem, before the main motor tracks for the body cross over to the other side. Seeing this pattern is practically a slam dunk for a brainstem lesion.
Okay, so with all of these pieces, the M's, the S's, and the idea of crossed signs, how do we actually use this in a real clinical scenario? Let's put it all together.
All this knowledge gives us a clear three-step diagnostic process. First, you look for those crossed signs. If you see them, you've pretty much confirmed the problem is in the brainstem. Step 2, you analyze the other symptoms. Are they M problems like movement and vibration sense, or are they S problems like coordination and sweating? This tells you if the lesion is in the middle or on the side. And finally, step 3, you identify the specific cranial nerve that's affected. This acts like a GPS, pinpointing the exact vertical level of the stroke, whether it's high up in the midbrain, in the middle at the pons, or down low in the medulla.
And that's really the power of this tool. The Rule of 4 takes this incredibly complex neurological map and turns it into a clear, logical diagnostic path. It leads to faster, more accurate diagnoses. It's a perfect example of how an elegant little trick can help us master complexity. So the next time you face a complex puzzle, ask yourself, is there a simple rule, just like this one, that's just waiting to unlock the answer?